Cool. All right, so let's start walking through this somewhat. So this presentation purposely was titled Integrating Career and Mental Health Counseling, and with the subtitle of A Leader's Perspective. So let me let you know what this meeting is not, what this presentation will not cover. It isn't a scholar's perspective or a professor's perspective. So we're not really addressing the scholarly work on how to integrate career and mental health counseling, but it's subtitled A Leader's Perspective. So taken from somebody who is leading a group private practice, which I'll talk about here in just a second, how somebody who's in leadership, somebody who has influence, is trying to move an organization to integrate career and mental health counseling. Now, some of you might respond by saying that you're not a leader, you're not running a private practice, you may be an employee at some entity. So let me just say to you that if you are a person who's influencing other people, you're a leader. So leader isn't really one that has a position of leadership. A leader really is one that has influence, that's influencing a department, a company, or clients or family or whomever it is to another place. And so that's why I titled it Integrating Career Mental Health Counseling, A Leader's Perspective. And my hope today is really by the time we're done that you have some practical steps as to maybe how to begin to integrate these two in your practice. So let me just briefly tell you a little bit about myself. So I'm the owner and leader of a group practice called Restoring Hope Counseling and Coaching. I got the opportunity to start that practice in 2012. So we're just over 9 years old. Fairly sizable group practice of about 45 folks, and we in the last year and a half or so began to really plan out moving the practice to integrating not just career counseling, but some other areas, which I'll talk about in just a moment. I'm a LPCC-S, a licensed professional clinical counselor supervisor in Ohio. I'm also getting ready to start my third year in a PhD program in counselor education and supervision at Regent University. It's hard to believe that I'm 2/3 of the way through the classwork, but that's where I'm at. For the last year and a half, I've been an adjunct instructor at Regent University, primarily teaching classes on grief and bereavement and facilitating an internship class. At Nyack College and Seminary this last semester, I team taught a career counseling class at Nyack College and Seminary, and that was a lot of fun. And a focus of my co-teacher and I, the focus of that class was to encourage the students to think about integration of career mental health counseling. When I took career counseling in my master's program, I don't remember any discussion about the integration whatsoever, and it was about 15 years ago. And so we had focused greatly on how to try to integrate these two initially in the minds of the counselor. And the students came in like I went into career counseling class, not really anticipating much out of the class, but they came out really encouraged. I'm going to talk about this in a minute, very interested in the integration of what I call the silos of counseling. We'll talk about that in just a minute. And married with three mostly wonderful teenagers. They're wonderful most of the time, and I do enjoy them a lot. If you have had teenagers, you probably know what I'm talking about. All right, so why integrate career and mental health counseling? What do I mean by this? So typically in our profession, and especially those of us who are mental health counselors, but also for those of you that are here that are career counselors, what we tend to do is silo our profession, meaning we tend to think about like mental health counseling, and we think about addictions counseling, we think about career counseling, we think about couples, we think about marriage and family as if they're separate things. And they are separate specialties for sure. Yet, I think we probably do our clients a disservice by only thinking about treating a part of a person rather than their whole. There has been a greater movement in our profession in integrating mental health and addiction work together, which I applaud. I think that's fantastic. There's been some work, not as much, on integrating mental health and career counseling together. So that's what I mean about the siloing of our profession is we have these specialties and we can get trained in these specialty areas, which I think is the right thing to do. Then often once we step into practice, either a private practice or a community mental health or a university, whatever we're doing, we tend to only focus on one space. And I do understand there are licensing issues that lead us to that as well. And so hopefully that's something we'll address. I can help address way down the road here. So to integrate career mental health counseling, what do I mean by that? What I mean by that is as a counselor, and I'm a mental health counselor. This is also true, I believe, for career counselors. That as we are sitting with our client, or as we have a new client coming in for an intake, that we start with thinking about working with the whole person, not just the mental health issues that they're bringing in, but also some career issues, perhaps addiction issues, perhaps family or social issues or cultural issues or whatever, the school issues, whatever the case may be. So this is what I mean about integrating career mental health counseling is really starts with us as counselors, as the professionals, having a mindset of integration. Okay, so let me start off by giving two illustrations here. And these are two clients that I've had. Obviously, the names have been changed, and these pictures obviously aren't the pictures of these two clients. But I want to describe, I want to give two illustrations as to what I mean. And these two men that I saw probably in the last 3 years or so. I didn't see them at the same time, saw them spread out a little bit. They're the ones that really prompted me into thinking more about, in my practice personally that I do individually, in my company, helping us to think about integrating these two areas. So let me first talk about Wayne just real quick. Let me kind of read the summary that I wrote down for the reasons why Wayne came into counseling. So Wayne came to counseling because he said, he told me he was stressed out. He reported not sleeping well. He worries every day about everything. Those are quotes. He worries every day. Said, "I'll worry every day about everything." It's a lot of trouble concentrating, and he's really irritable. And I saw that in session. Really anxious. A quick trigger in regards to his anger in session. And so I began to think about generalized anxiety disorder, and that, in fact, is something I diagnosed him with after getting the other assessment information, of course. He reported to me that because of the anxiety and the stress, his marriage was being impacted negatively. And his goal was to reduce stress and anxiety so that he could return to the level of functioning he was prior to coming to counseling. Almost as an aside, he said, and I wasn't thinking to ask about this, almost as an aside, what he said was, because he's anxious and stressful, he's not sleeping well. And so he's missing days at work. And when he's gone to work, his performance has come way down. And his boss has been noticing that his performance has been coming down and has been trying to address this issue with Wayne. So Wayne said that as an aside. I then inquired about it because I'm a counselor. I'm curious. And so I asked more about that. And so effectively what his answer was, what his summary was that, well, because now his boss has come to him and been questioning his performance, now his anxiety and stress continues to get fed into and continues to increase, which has a greater negative impact on his marriage. He told me he was interfering with his sleep more. His mind was racing about if he was going to lose his job, which meant he didn't sleep as well and was missing work and et cetera, et cetera. It turned out to be this vicious cycle. So the question I have, and just for you to think within yourself, is: do you see how Wayne's emotional health issues might be impacting his work, his life, his marriage, and how if he lost his job, that might impact what he does, or being able to find another job and maintaining that job? I think the answer is obviously yes, as it would be for us as well. So let's talk about John real quick. So John came to me for counseling because, and I'm going to put some air quotes up here because I want to quote some things he said to me. John came to counseling because he's looking for another career to fulfill him, quote unquote. That will be in alignment with, quote unquote, my purpose, is what he said. As I got to know him over the first couple sessions, one of the things I learned about him is he had 5 career changes, not 5 job changes, 5 career changes in the last 10 years. So he radically changed career paths in the last 10 years. He changed 5 times. So I began to get curious and asked him about it. Why the 5 job changes? And what he said to me was this: he tells me he's not been able to find the perfect, quote unquote, job. And when somebody, quote unquote, screws up, and then, quote unquote, which they always do, he emphasized, he says that he quits on principle. He says most people are, quote unquote, idiots, and that he'll know he finds the perfect career. He'll know that he'll find the perfect career when everybody else just do things that make sense, quote unquote, like he does. So he was a very interesting guy I worked with. Just very shortly, I concluded, although I did not officially diagnose him with this because I didn't see him long enough, after he stopped seeing me, I concluded that he most likely had a personality disorder. So how might this personality disorder affect my work with him as a career counselor? If I'm a career counselor and this is my client, and he's coming in for career advice, let's say he's looking to find the perfect job where everybody does things that make sense, because everybody else is an idiot and he isn't, from his perspective. As a career counselor, would this personality disorder, or what appears to be a personality disorder, affect your work with them? But I think the answer obviously is yes, to that as well. The conclusion I draw from these 2 illustrations and from other clients I've had is, and this is an obvious statement, I hope, is that nobody really lives in a vacuum. Nobody lives in a vacuum. We can't effectively work with anyone if we just compartmentalize them, if we silo people in doing just mental health counseling or just career counseling. So the goal of this presentation really is to really kind of give you a foundation from a leader's perspective of how to integrate these 2, career and mental health counseling. All right, so we're going to put you into groups here in just a minute. We're going to do this for 7 minutes. I want to read this quote to you, and then I'll give you a quick little a task to do in the group. So this quote is from Max Dupree. I read this many years ago. And the quote says, "The first responsibility of a leader is to define reality." The first responsibility of a leader is to define reality. So again, you might think that you're not a leader because you might not have a position of leadership. So I'm going to want to challenge that to say, if you have influence over anybody in the entity you're working in, with your clients, which hopefully all counselors have influence with their clients, with other people, then you're a leader. Leadership is defined for our purposes as influence. So the first responsibility of a leader is to define reality. So you're going to be broken up for 7 minutes into the breakout rooms. And I want you in your group, there's going to be 3 to 4 of you in the group. I want you in the group to discuss this question. What does this quote mean to you? What does this quote mean to you? What are the things in this quote that you can pull out that are meaningful? The first responsibility of a leader is to define reality. Max Dupree. Thank you all for coming back. That's exciting. Everybody's back in the main room. One of the things that I miss, and probably you all do too, about being in the same room together, is the energy that you feel, and people doing breakout rooms, and you feel the energy and hear some of the discussion. So this is a little different. So what I wanted to do here in the next, just a few minutes or so, just to hear from each group, maybe just one person in each group. Take 30 to 45 seconds or so and just summarize what your group talked about in regards to what the first responsibility of a leader is to define reality quote meant to you all. So good. Somebody just pop in, unmute your mic, and give us a 30-second or so summary.
So my group initially talked about how we all thought this is a really profound question, and how everyone defines reality differently. Everyone has different experiences. And someone said everyone is a leader because we all have something to contribute, and there's lots of different lenses to see what's going on. And, the pandemic is a good example of that. We talked about how leadership begins with listening and observing. And I thought of this quote as like, a leader kind of creates the path, and other people kind of follow down a similar path, similar journey, once they see that one person was successful.
Yeah, absolutely. Thank you. Who's next?
I'll just jump in here. Our discussion centered around the fact that, if the notion of reality has to be dealt with first. And one of the members of the group, Kara, I think her name was, said that with her students, she does a process of deconstructing whatever they perceive their reality to be. And that, I think that's a good process to use, because if the leader or whomever is in this role of leadership has to first understand that reality is the goal, to help folks to understand what reality is in terms of their career development experiences or their career trajectory. And it's different for everyone. But at the same time, not losing sight of the fact that that's their goal. And perhaps using, the example we gave was one of the students might want to be an NBA star. Well, gee, that doesn't mean that you can't take those skills or that interest or that motivation and help them, as she said, to deconstruct that goal and use that to perhaps try something else that may be, just to use your word, a little bit more realistic. So that was kind of the premise of our discussion.
Yeah, excellent. Let's have two more people, two more groups. Who's next? Anybody? If not, that's okay. I can move on.
I think we were in our group, we had a good discussion about group, jump in if I'm not quoting you correctly, but that we had to meet whoever we were meeting with, we had to meet them in their reality. We had to go to where they were. And so to define it would not be in our eyes, but to define it in their eyes, because we can't move them further along if we're not where they are.
Right. Good. Very good. Thank you so much. Okay, so let's go on here. So we're going to be talking about steps to integrating career and mental health counseling. Now, this is taken largely from a perspective in integrating within a practice, maybe an entity, but certainly it also applies to the one-on-one work that I do, that you do as well, whether you're a mental health counselor or a career counselor. This comes thinking at an organizational level, yet these things can be applied certainly one-on-one. So let's talk through these a little bit. I've let them all up here so you could take notes, but let's talk through this real quick. So these are leadership steps towards integration And again, this starts with us thinking, having a mindset that we should or can integrate, but also thinking organizationally. So the first step is learning to communicate the current reality. So here in a minute, I'm going to briefly summarize, give some information that will help at least begin to lay a foundation of what some aspects of the current reality is towards integrating mental health and career. So learn and communicate the current reality, really in order to know where we want to go to as an organization or one-on-one with our clients, of course. Pardon me. In order to know where we want to get to, we have to know where we're starting from. That's really the first step. And this is what this number one step is: learn to communicate the current reality. Okay. So for example, if my private practice is down in Cincinnati we had two offices, one in a subdivision or suburb of Cincinnati called Springfield Township, and then another office over in where I am today in a subdivision called Sharonville. And so if I'm on the phone with somebody in Dayton, Ohio, and they want to know how to get to see me in my Finneytown office or my Springfield Township office, in order for me to tell them how to get to my office, and they're in Dayton, Ohio, I need to find out that they're in Dayton, Ohio, so I can tell them to come down 75 and come on over, to my office that way. Okay, so I in order to give them directions and start planning out how to get somebody to my office, I have to know where they're starting from. The strategy is different if they're coming to me from Indianapolis, right? So now if they're coming to me from Indianapolis, they're starting from a different place, and the directions to get them to my office is different. So learn and communicate the current reality. Let me give you some practical suggestions here. Spend a little bit of time researching the overlap of mental health and career counseling. I'm going to give you some information here in the next couple slides to help you with that. But there's so much good work out there that really go into Google Scholar and just Googling overlap or integration of career and mental health counseling will bring up a lot of recent scholarly articles. So spend a little time researching that overlap. Also inquire of your current, I would suggest to you that you inquire of your current counseling clients, whether they be mental health or career counseling clients. Inquire of them if they're coming to see as a mental health counselor. Ask them about their career issues, if any. If they're coming to you for career issues, ask them about some mental health issues that they might have, if they have any. And so anecdotally now you have some information from them. And if you're leading an organization or a team or a department, or you're in a group of people, communicate that information over and over and over again, very simply. The second leadership step towards integration is define as clearly as possible the reality you want to create. And again, I'm going to address that to show you what we've done at my practice right towards the end of our time today. Really just to say this is what we're doing, maybe to give you a template to think about in your organization or in the work you're doing. So thirdly, plan a strategy to turn the dial from the current reality to the desired reality. That strategy doesn't have to be a perfect strategy. I think part of what freezes people up the most in developing and leading and moving towards a new reality, a new destination that you might want to get to, is they want that strategy to be perfect. So I don't know about you. I've never created a perfect strategy. Maybe you have, but I certainly have never done that. So what I suggest to people as I teach leadership, as I in my own leadership team, and I just remind myself, is instead of trying to plan out a perfect strategy, I just identify the three first most plausible steps that make sense to me to start. So the first three logical steps that might be, for example, with one of my clients, I did this on a mental health issue, not so much the integration here, where he was really anxious about getting a job, looking for a job. And so the first plausible step was, well, let's open up your computer and turn it on and Google something. Okay, it could be that practical, that pragmatic. And so we identify the first 3 plausible steps and starts, and then go to number 4. And so number 4 is really important, that we try the first 3 steps. We try it, we test it, we evaluate it, we try it again. So finding a way to test it and evaluate it implies that we have identified some way to measure what we're doing, to see if we're successful or if we need to start over in that process again. Okay, so we evaluate it, we try it, rather, we test it, we evaluate it, and then we try it again. And we keep refining our process over and over and over again. And then, of course, as we are having successes, we find ways to celebrate. We find ways to celebrate there. So those are some leadership steps towards integrating within a practice to move towards this integration. So, Chelsea, you have a question?
Not really a question. I just wanted to say that I really like the point of number 4. A lot of talk in career counseling right now is focused on like design thinking. And so if you guys are familiar with that Design Your Life book, that's a really big kind of theme in career development right now. And this is exactly what it is. You know, kind of almost creating experiments. We're kind of engineering our own careers. And I don't think we always think about it that way, but I like that point. And this actually makes it sound doable. Just try it, just test it. I like it.
Absolutely. Thank you. Thank you. And what I love about this is, at least my mindset, it gives me permission to fail, right? Because I've only laid out the first 3 steps. If I laid out the first 300 steps, then man, if I tested early, then I have to create a whole new strategy, which can feel overwhelming. But we just try the first 3 steps. And then if I fail, it's not that big of a deal. I've learned something from it, and I've tried again. So what I want to do is kind of help define a current reality. Okay, so this is very little information, but it's not to give a template, or it's enough to begin to demonstrate how I think about it, at least from a leader's perspective, is defining reality here. So what's the current reality? So that I got this information about 6 weeks ago. So my guess is it certainly hasn't changed, or not very much. So we know the current reality regarding how COVID-19 has impacted the work environment. This information was very easy to find. So any more information would be easy to find. So 7.7 million people lost their jobs from last March, when lockdowns began to roll out from state to state, and state governors were locking things down and closing things up. 7.7 million people lost their jobs between March and June. Okay, so we all remember that. We all lived through that. By December of 2020, 22 million people had lost their jobs. By December of 2020, there were 10 million fewer jobs than there were prior to the pandemic. So even those folks that lost their jobs, who were then trying to find jobs during the pandemic, were having more and more trouble finding jobs, simply because the number of jobs weren't out there. What is also the current reality about how COVID-19 affected mental health? And again, this is just a quick snapshot, and there's a whole lot more information about how COVID-19 has affected domestic violence, has affected all sorts of things. But just for our purposes, just wanted to illustrate how, for example, COVID-19 has impacted mental health. And again, this information is really easy to find. So this information comes from SAMHSA. Anxiety and depression rose 11% from June 2019, so that's before the pandemic, to 41% just a few months ago in January. There is a 5-fold increase in calls to suicide hotlines from March of 2020, when the lockdowns began to happen, to January just a few months ago. And in some states, just as a caveat, in some states, that increase in calls to suicide hotlines was much greater than a 5-fold increase. There was a 13% increase in the use of substances, an 18% increase in overdoses, So let me back up here just real quick. So it seems all this information here on the screen and in this previous screen would indicate it would stand to reason. Let me say it this way: it would stand to reason that for a large portion of the people throughout the pandemic and still at this point, who have lost their jobs and have also had increases of intensity or rates of mental health issues, may have a harder time looking for a job or sustaining a job. This is the current reality, and so the importance of us being able to integrate these two and us as career and mental health counselors to be thinking in our mindset, having a mindset of how can I integrate either me helping the person with career as a mental health counselor, me as a mental health counselor helping an individual with career issues, or do I know somebody who's a career counselor that I can partner with, I can work with to help my clients through this process, and vice versa. So just a quick slide here. Behavior, both normal and abnormal, is the product of a continual interaction of biological, psychological, and social influences. And then I've listed here, and this is in the references here in my presentation. So the references are there. But there is a whole in the Career Development Quarterly from 1993. So this is fairly dated at this point. There was quite a few articles that laid out kind of reasons why we should be integrating. These were not the first series of articles, but they seem to be an important series of articles that laid out why we should integrate career mental health. And many times they called this integration of career and personal counseling. So they're phenomenal articles. You'll have access, or you will be told how to get access to the PowerPoint later on here, so that you can look at these articles if you like. Some of the commonalities with career and mental health counseling, there's not much of a leap to go from being a mental health counselor to a career counselor in these ways. Both career and mental health counseling is based upon a relationship between the client and the counselor. And this is information that comes out of these articles and others. We know that employment gives meaning to people's lives, and finding that meaning, helping our client find a meaning, improves that person's general overall mental health. Both career and mental health counseling are goal directed. The clients get to point out, this is what I want the end of counseling to be. This is how I'll know my counseling is successful, kind of question. Okay, so what are your next steps? I'm going to offer you some ideas here of what your next steps are, and then I'll talk about what we did just briefly. I'll talk about on the next slide what we've done in my company and are doing. We're a little bit in the process of doing this, of integrating these two in practice, and then we'll leave a few minutes for Q&A. Excuse me. So what are your next steps? So here's some questions that I have for you. How are you, and these are for you to answer, to think through and thinking more largely than just one-on-one counseling with a client. How are you defining reality right now for your clients and community? What I don't mean by this is, are you defining their reality? What I do mean by this question is, how do you understand what the overlap of, or the interface between career mental health issues in your community that you're serving? Do you see that there's an overlap, an interface going on here? So that's what I mean by this question, not that we're trying to define reality for that individual person. Second question is, do you ask, if you're a mental health professional, do you ask about career issues in the assessment and throughout the counseling process? Do you just inquire about it? It doesn't necessarily always have to be a focus of the assessment or the counseling, but do you ask about it? And if you are a career counselor, do you ask about mental health concerns in the assessment or throughout the counseling process? And again, if we aren't licensed appropriately to manage both, or if we don't feel competent in managing both, do we know somebody in our community that we can refer our client to, and then we can partner with that other counselor to work together to help our client holistically. Last question here is, how knowledgeable and comfortable are you with the career assessments if you're a mental health counselor, such as the career beliefs inventory, career thoughts inventory, career assessment inventory, and I know there's plenty of others. Or if you're a career counselor, how comfortable are you with mental health assessments like the Beck Depression Inventory or the Beck Anxiety Inventory? I would propose that to integrate that even if you are a career counselor and not a licensed mental health counselor, it may be advantageous for you then, and ultimately for your community and your clients, to at least be familiar, for example, with the Beck Depression, the Beck Anxiety Inventory, and many others too. There are many others out there. And for those of us that are licensed mental health counselors, it may be beneficial for us and then ultimately for our clients to be aware of career assessments like these listed and others. So here's what I kind of painted for my team. Again, I have about 45 folks in my practice. Not all of them are counselors. Some are just our administrative folks, but I include them in this too because we're one team moving forward. So this is what we did, and I wrote this kind of in the third person. So this is what we did. I'm not suggesting this you have to take these steps that we did, but perhaps it's a template. So the first thing we did was we began to talk about and see the value. It started with me as the leader to see the value of integrating these two areas. And as I said earlier, not see them as separate silos. So this is kind of the future that I'm trying to paint for my company as we try to help more people. The second thing that I've done and some of the other folks in my practice have done is we familiarized ourselves with the literature around this integration. And there's some really good literature. There is, for those of us that, and I historically have done some substance abuse counseling with treating people with heroin and crystal meth addictions, things of that nature. And there's a lot of good scholarly work integrating those two areas. And so how we got better at that in my practice historically was we looked at the literature on integrating mental health, treating mental health and substance abuse. So much in the same vein, looking at the literature that discusses this integration and becoming somewhat familiar with it at least. The third thing we did is that we're making it a point for our counselors to be intentional during the mental health assessment to ask about career issues, ask about how their career is going, how their job's going. And in the career assessment, there's a misspelling in there, my apologies. In the career assessment, we ask about mental health concerns. Well, we don't, as career counselors. I would suggest that career counselors ask just about mental health concerns. Perhaps you get to ask if they see another counselor, if they see a counselor, or if they have any mental health concerns. Also, we tend to have a career, and not for everybody, not for all of our clients, but we're open to the idea of having a career goal in the treatment plan. And that's only, of course, if the clients want that, if they're seeing that there's a career issue going on. But we're open to the fact. It starts with our mindset. Throughout our work with the clients, we are pretty consistently asking, hey, how's life going? How's your family? How's your job? How's your job search, or whatever the case may be? We've gotten familiar, of course, because we're mental health counselors, with the BDI and the BAI. That's the Beck Depression Inventory, Beck Anxiety Inventory, the PHI-9, others, and then also career assessments. We're getting more and more familiar with those. And then we always have a plan for the client to return to us later on if they need us. We inform them as to what might be some indicators for them to come back to us, and some of them take that up, and some of course don't. So this is a little bit of how we've laid out the future for my company, Restoring Hope Counseling and Coaching, and perhaps this is maybe a little bit of a template for you to use if you're in private practice or if you're in an entity somewhere to begin to take some of these steps perhaps. So any questions or comments or discussion? We have, looks like about 6 or 7 minutes or so.
Yeah, I just wanted to say, I feel like, and I think I said this in the chat a little bit earlier, but I think that a lot of clients or students, for those of us that are in higher ed, they don't necessarily see the connection between career and mental health. And yet we live in a society where that is so much of our identity. Like that's the first thing anyone asks anyone is, what do you do? Or what's your major if it's a college student? So I definitely think it's really important. And I am with Lisa. She just wrote in the comments too, the crossover information on the different inventories is really helpful. It does really make sense.
Fantastic. Any other questions or comments or discussion?
I personally appreciate how you brought up like populations who struggle with addiction. I'm working a lot with those who struggle with addiction currently, and that's definitely an area that can help them in their recovery, and that's so important, being able to find what their skill set and their strengths are, and be able to work on not only mental health but also getting them back out there into their career field.
Absolutely.
As somebody that's just getting started in the mental health counseling plan, it's a third career getting started in the fall. Do most programs, should I expect my program in the mental health counseling field to incorporate counselor or career ed, or will that be really something I need to seek out on my own? I know it's dependent a little bit on the program, but overall,
Right.
Would you say?
So is this a master's program you're in, or a?
It will be. It will be a
Yeah.
master's.
My experience is that at especially in both the master's and the doctoral level, that there is not much discussion about integrating, if any, discussion about integrating or overlapping the two. It's more about just learning initial information about career development and career counseling, those kinds of things.
Good to know.
Yes. Yeah, and in my opinion, that's unfortunate, because I think it, especially if one is in a mental health counseling program, we don't initially do a lot of career counseling, yet it's so important, and perhaps we ought to be comfortable to do that.
And when people are feeling lost and helpless, looking at their strengths and developing those strengths
Absolutely.
in a way that may be lucrative, it just seems like a win-win. I'm surprised there's not more overlap.
Yes. Yeah, me too. I agree with you. And perhaps this training is the first one of many. The first one that will push for this integration. That would be fantastic.
Yeah, thank you.
Absolutely.